Hello, everyone, and welcome back to the Vegan Gym Live. I am Dr. Daphne Bascom, your host, and today I am doing a special solo episode from my couch. So I apologize for the not so beautiful background, but still recovering from a recent uh, right lower extremity fracture and wanted to bring this episode to you today because I wanted to close out October with a very important and empowering conversation. So today I want to talk about a potentially overlooked topic, although I think it's becoming more popular due to, menopause is having a moment. But October is Menopause Awareness Month, and it's a time dedicated to normalizing and elevating conversations about menopause. This whole month, we've been focused on empowering women with knowledge. And that's what I love to do. I want to break through the stigmas. I want to give each of you the tools to navigate the stage with confidence and with resilience. This year's Menopause Awareness Month theme highlights menopause hormone therapy. You may hear it referred to as MHT, and MHT is an option for managing menopausal symptoms. Today, what I wanted to do was to talk a little bit about how understanding menopausal hormone therapy, nutrition, exercise, mindfulness, and other tools can help you in how you approach menopause, no matter where you are on the journey, with both strength and resilience. Let's start by providing a bit of background because I want to make sure we're all on the same page. And I want to clarify first what natural menopause is and talk a little bit about the journey leading up to it. Perimenopause, which is often called the menopause transition, is a phase that can begin several years before menopause. And this usually starts for women around their 40s, sometimes even earlier. During perimenopause, your hormone levels, especially estrogen and progesterone, begin to fluctuate and slowly decline. So you may hear it called the hormone roller coaster. And these changes can lead to a range of symptoms, leading to irregular menstrual cycles, hot flashes, night sweats, mood swings, musculoskeletal pain, genitourinary changes, and sleep disturbances. These aren't symptoms that just occur postmenopause. All of these symptoms potentially can also be occurring during perimenopause. And the body is adjusting, and sometimes the adjustments to these hormonal changes are unpredictable. There's some women who may have no symptoms, and there's some women who may be impacted significantly. Every woman is different. But remember, every cell in your body has receptors to these hormones. And so these changes can manifest in a variety of ways, but it is unique to you. After perimenopause comes menopause, and menopause starts 1 year after a woman's last menstrual period. And this milestone often occurs around age 51. That's just a median age, and it marks the end of our natural fertility. So that means after a year without a period, we are considered postmenopausal. I know the terminology is a little bit wacky, but I didn't create it. That's the current state of how we talk about menopause. This whole menopause transition really being perimenopause. You go 12 months without a period, now you're postmenopausal. But several of you have reached out to me because I natural menopause doesn't occur for every woman. And I also wanted to explore several unique forms of early menopause, which are primary ovarian failure, surgical menopause, and chemical menopause. And I also want to talk a little bit about the sudden transition into menopause and the impacts on your short and long-term health. Primary ovarian failure, which is also known as premature ovarian insufficiency or POI, occurs when the ovaries lose their natural function before the age of 40. In women with POF, primary ovarian failure, the ovaries stop producing the normal levels of estrogen and may stop releasing eggs regularly. And that can lead to symptoms similar to menopause. Causes of early primary ovarian failure can include genetic factors, autoimmune factors, or other unknown factors. The impact, because the loss of estrogen happens much earlier than usual, primary ovarian failure may increase the risk of osteoporosis, heart disease, cognitive issues, and these are all due to the long term absence of estrogen. And just as we discussed the other symptoms related to menopause, hot flashes, mood change, sleep issues, musculoskeletal changes, these may appear at a young age, and they may require both hormonal and lifestyle interventions to manage these symptoms and reduce long term risks. That's primary ovarian failure. Surgical menopause refers to the sudden onset of menopause following the removal of the ovaries, often during a hysterectomy. And since the ovaries or, the release of the egg produces the estrogen and the other hormones, when their removal occurs, there's a rapid drop in hormone levels. So, unlike natural menopause, where while you're on a hormonal roller coaster, your estrogen and progesterone and your hormones are dropping over time, surgical menopause and chemical menopause could bring in immediate, intense menopausal symptoms overnight, more common with surgical menopause. And this sudden change can lead to severe hot flashes, night sweats, mood swings, sleep disruption, everything I talked about previously. Again, the absence of estrogen also increases the risk of osteoporosis, cardiovascular disease, and cognitive decline over time. So if you are a woman who may be considering a or need to undergo a hysterectomy and the complete removal of your ovaries, so total abdominal hysterectomy, bilateral salpingo oophorectomy, you may see it called TAH-BSO, please talk with your healthcare team about what will happen post surgery and what considerations you may need to take related to hormone replacement therapy. Chemical menopause is a temporary or permanent menopause induced by medications or treatments that affect the function of your ovaries. And this could be chemotherapy or medications for hormone sensitive cancers. And these treatments are designed to lower or block estrogen and can cause a rapid decrease in hormone levels, leading to menopause like symptoms in women. And this can also happen to men who may be receiving hormone therapy for prostate cancer or other hormone sensitive cancers. Again, same as I mentioned previously, women experiencing chemical menopause may face similar symptoms to natural menopause, although these symptoms may improve if ovarian function resumes after treatment. What's the key takeaway here? So I wanted to address this, and I want to thank all of you who have reached out to say, but what about me? We talked about natural menopause and how that's defined 12 months after your last menstrual period, occurring about age 51. There are women who go through menopause early, whether it's through primary ovarian insufficiency, chemical or surgical menopause. But the takeaway is that navigating early or sudden menopause may require you to consider a combination of a hormone therapy and lifestyle intervention. You also need to think about nutrition, having a balanced diet that's rich in calcium and vitamin D, making sure you're doing regular weight bearing exercise. We'll talk more about this later, but understand that menopause has unique impacts and it's essential for you to make empowered, informed choices about your health and well being. And whether you're listening as a woman, born female at birth, or you're listening today or watching today for a loved one, knowledge about both natural and early menopause is important. This month, the focus is on highlighting the science and the support systems to help women make choices related to menopause hormone therapy, or MHT. And what I'll do is I'll attach a wonderful white paper that was published by the International Menopause Society. And what I want to do next is to summarize some of the recommendations from that paper because I think it's important to talk about. Menopause hormone therapy, also known as hormone replacement therapy, has evolved based on new research and a better understanding of its benefits and its risks. And when used properly, it can offer relief from some of menopause's challenging symptoms, and it can also protect you from some chronic diseases that are correlated with the decline, most importantly, in estrogen over time. I want to acknowledge up front that there's been some historical controversy and confusion around hormone replacement therapy. And past studies have led to concerns around breast cancer and heart disease risks. But further research has now demonstrated that these risks vary and that MHT, menopause hormone therapy, hormone replacement therapy, is a safe and viable option. And this is a conversation that you need to have with your healthcare team. And that's the whole point of this year's awareness campaign, to clarify that MHT can be a safe, effective option when it's tailored to each individual's unique needs and your personal goals. So it's about making informed decisions with a trusted healthcare team to ensure that the therapy aligns with your unique journey. Now, I'm not telling you to run out and ask your provider for menopause hormone therapy. I do want to say, and I want to break down the stigma, I have taken menopause hormone therapy. This is a combo patch. I'm actually no longer taking it, which has been interesting that while I was navigating my post trauma hospitalizations, I wasn't on the patch and I've had minimal symptoms. Um, but I want to take away the fear, the stigma, or the concern that you have to white knuckle it through menopause. You don't. My goal is not to tell you that you need this. My goal is to provide you with education so that you can make informed choices. To that end, I want to highlight some of the key recommendations related to menopause hormone therapy from the IMS white paper. And again, I'll share a link. I'll post this on our Facebook page so that you can read the full paper at your leisure, and also a link to the International Menopause Society because they also have a lot of very helpful information that is written in a very easily consumable form. I'll try and keep this short. Um, let's start with primary indications. Menopause hormone therapy is typically recommended for women experiencing moderate to severe menopausal symptoms, and these include vasomotor symptoms, i.e., your power surges or hot flashes, genital urinary symptoms such as vulvovaginal atrophy or genital urinary syndrome of menopause. There are multiple secondary indications, which I won't go into, but those are the primary indications that are outlined in the IMS white paper. But again, my advice and my approach is to treat the individual. So there are a whole spectrum of symptoms that occur with menopause. If you are experiencing symptoms, please have the conversation with your healthcare team. The second thing I want to highlight from the paper is that the IMS recommends body identical hormones, such as estradiol and micronized progesterone, as preferable options to synthetic alternatives. Why? Because they may offer a more favorable safety profile. Um, the dosages may be easier to control. They are more FDA regulated. So there are many different reasons why that is the position that the IMS is taking. They also recommend that the treatment should be tailored to the lowest effective dose that manages your symptoms. There's no one dose for every woman, which is why I keep saying treat the individual, don't treat the number, don't treat, to a recommendation. The goal is to treat you. There also is not a mandatory treatment duration limit. And to that end, the use of menopause hormone therapy should be individualized and not necessarily adhere to some arbitrary duration. So it doesn't just have to be 5 years. You need to continuously reassess. Even after you initially start, you need to determine your ongoing need and you need to treat the individual. And again, it's interesting that I haven't worn the patch now in since end of August and I haven't missed it, which probably means maybe I no longer need it. But that's a conversation I'll have with my healthcare provider too. The IMS white paper also goes into detail on when to initiate and potentially when to stop menopause hormone therapy. Again, the initiation conversation may be one that you want to have based on your own personal symptoms, your risk profile. Um, waiting, I don't believe that you need to wait to start until you're in menopause to consider hormone replacement therapy. That's Daphne's recommendation based on my interpretation of the literature and the recommendations today. It, when you start going through perimenopause, you need to think about the risk to your bone, your brain, your bones, your genitourinary system. These are all considerations that need to be made. I do want to bring up one other point that the IMS makes in the white paper, which is the disparity in access to menopause hormone therapy. Now, health equity is important to me. And it's interesting that even with this patch, when I recently changed my health insurance, I wasn't able to afford applying the patch at the twice weekly duration that was recommended. So the IMS acknowledges that there are significant inequities in access to menopausal hormone therapy, especially in low and middle income communities and countries. And there's a call for improved awareness, accessible education, resources so that there is more equitable access to menopause hormone therapy. And, it's not just in countries worldwide, that is even in the United States. And that's why I'm so passionate about having these conversations and also about encouraging our pharmaceutical companies and our health insurance companies to make these affordable options for all women. Again, these are just some of the many recommendations in the white paper. The paper goes into each of these topics in detail and includes a conversation on non hormonal therapies too. And I would really encourage you to read it. But what I'd like to do next is to explore 5 strategies to help make the menopause transition smoother and support your health and well-being. And these tips are going to focus on sustainable lifestyle changes that can improve your quality of life and also help with your long-term health. The first, and you can probably guess it, which is prioritize nutrition. And this is prioritizing nutrition for both your health and weight management. Menopause can and often does bring changes in body composition, and that can include a natural increase in abdominal fat and a decrease in muscle mass. And there's a whole reasons why you may see, the kind of the menopause middle, and you may also be noticing that you are not as strong or as robust as you were in your 30s or 40s. But a balanced plant-based diet, rich in fiber, protein, healthy fats, calcium, and vitamin D, can support not only weight management, but also your overall health. And to accomplish this, you want to focus on whole foods, leafy greens, legumes, whole grains, nut seeds, and fortified plant-based milks. Yes, I'm going to talk about protein. Protein intake is important for women through perimenopause and menopause, and it's particularly important to prevent muscle loss. And this muscle loss is called sarcopenia. And sarcopenia can become a concern as we age. If you combine sarcopenia with excess body fat, a condition called sarcobesity, where both muscle loss and fat gain occur simultaneously, you're now also opening the door to increasing the risk of metabolic issues. Insulin resistance is more common during menopause, perimenopause, and menopause. And these are things that we need to actively manage. So aim to incorporate quality protein sources, your beans, your lentils, your tofus, your tempeh at every meal. Center your meal around your protein. Omega-3 fats are also something that you want to consider, and these come from chia seeds, flax seeds, and walnuts because they can help reduce inflammation and support cardiovascular health. Estrogen is very anti inflammatory. So when we start to lose our estrogen, we need to find ways to reduce our total systemic inflammation. And a well balanced plant based diet can be pivotal to maintain your healthy weight, maintain your muscle tone, and helping with your bone density. Again, it's not just me. um, Incorporating half a cup of soy products. This is a study came from the WAVE study out of the Barnard Medical Center, can be beneficial to help manage your vasomotor symptoms. There was another study that was published in the journal Menopause that found that women who consumed a diet high in soy experienced fewer hot flashes compared to those who did not. Get your antioxidants, get your colorful fruits and veggies. These will also provide you with an opportunity to combat oxidative stress and inflammation. Bottom line, a plant based diet rich in whole food will support your total health during menopause. My second recommendation, incorporate physical activity to build strength and prevent sarcopenia. Exercise is one of the best tools for navigating menopause and countering the effects of sarcopenia. Again, sarcopenia is this muscle loss that occurs as a combination of both just the natural process of getting older and also can be exacerbated through menopause due to the natural changes in our hormones. Physical activity can help support your weight management, your insulin sensitivity, it can support your bone health, and it's also important for maintaining your muscle mass. Strength training, yes, I'm going to talk about strength training. It's it's important. You want to be able to do all the things you love to do. I keep talking about the fact that this is an opportunity for you to reinvent yourself. Menopause is not an end to an era, it's the start of a new era. But you want to go into that phase of life healthy. You want to be able to lift your suitcase. You want to be able to clean your house. You want to be able to work in the garden. And to do that, you have to maintain your strength. So aim for strength training exercises 2 or 3 times a week, focusing on your major muscle groups. You can use resistance bands, you can use weightlifting, you can use body weight. If you're uncertain how to get started, you may benefit from working with a personal trainer or health coach who can make sure that you are doing this safely. Additionally, you want to think about cardiovascular exercises like walking, rucking, cycling, swimming, and those can be of benefit to your heart health. I also want to encourage you to stay flexible and maintain your balance. So think about yoga or Tai Chi or Pilates. These can enhance your mobility, improve your posture, and lower your risk of falls or other injuries over time. Tip 3. So we've talked about nutrition, exercise. Now, number 3 is sleep and stress. Quality sleep is vital for overall health. And I know, and I was there, many women experience sleep disturbance during perimenopause and postmenopause. Whether it's your hot flashes, your night sweats, or just the fact that you've got kind of that squirrel in your brain that you can't shut down. You need to prioritize your sleep. And establishing good sleep hygiene is important. That means create a bedtime routine, optimize your sleep environment, limit your screen time, and maintain a consistent sleep schedule, even on the weekends. There's no way we're going to get rid of stress. Stress is a part of being a human being. Managing stress, meaning controlling the controllables, is equally important, as stress can exacerbate menopausal symptoms and it can also impact your sleep. We can talk about, on future episodes of the Vegan Gym Live, Coach Sarah definitely is a fan of mindfulness and meditation, incorporating deep breathing. I probably do deep breathing exercises several times a day. Thinking about yoga and Tai Chi. These practices combine movement with breath control and meditation and can promote relaxation and mental clarity. And even journaling. It's one thing that I've actually gone back to as I've been on my recovery journey, and I have found it cathartic just putting things on paper. If you have sleep or stress issues, and please talk to your healthcare team. They may be able to help identify underlying causes and recommend appropriate interventions, but sleep or stress are important. The fourth thing is social support and connection. That's why we're here. Social support can be a powerful buffer against stress and improve your mental health. So, connecting with friends and family, supportive communities. And I'm not talking about getting likes on Facebook, I'm talking about connecting with people. They can help reduce feelings of isolation, they can help provide encouragement, provide accountability, and enhance your well being. And so communities like our Menopause Mastery community can offer a safe space to share experiences, to access resources, and more importantly, to make you realize one, that you're not alone, and two, that maybe you're not going crazy as you're going through these changes. And the last tip I wanted to share was you need a team of people around you to can help tailor a plan to support you. You are at the center of your care. Menopause is highly individual. So working with a team, whether it's healthcare providers, registered dietitian, nutritionists, health coaches, personal trainers, you need to identify needs that are specific to you. And that includes discussing options like menopause hormone therapy. You need to stay informed. You need to be proactive in your healthcare decisions. And don't hesitate to reach out with questions. That's what we're here for. A tailored approach with regular check ins can empower you to make the right choices for your healthcare journey. So, as we wrap up today's episode, remember menopause is not an end, it's a transition. It's an opportunity to prioritize you, to prioritize your health and well being, and to prioritize an opportunity to grow as an individual. So embrace this phase. Today, I hope you've enjoyed this conversation. We've covered a lot of practical steps to help you thrive during menopause, from nutrition and exercise to sleep and stress management. Don't go out and try and do everything tomorrow. That's not the goal. I would rather you choose even just one thing, be consistent, develop a consistent habit, and make it part of who you are and see how you feel. I know by focusing on your nutrition, your exercise, your stress, your sleep, changing just one of those, you will be able to navigate this midlife transition much more comfortably and you will feel empowered. So I encourage you to take this next step of your journey by committing to yourself. Connect with your healthcare team, join a support community to share and learn with others, set a small goal, like maybe trying a new recipe that's rich in calcium, adding a short walk to your routine, or even after you listen to this episode, get up and do 10 squats. That's great. Any way you can interject movement, healthy foods, stress management, better sleep into your life, These small intentional actions will build a foundation for a strong and resilient life, especially as we get older. Remember, you are not alone. There's an entire community of women and health professionals dedicated to supporting you on this journey. Reach out, stay curious, and together we can redefine what it means to navigate menopause with strength, with confidence, and with joy. So, thank you for joining me today on the Vegan Gym Live. Embrace this chapter one healthy step at a time. Tune in next week for more insights on thriving through all stages of life. I can't wait to continue this journey with you. But I would like to encourage you to do one thing. If today's episode resonated with you, share it with someone who might benefit. We're here to build a supportive community where no one has to navigate menopause alone. Thanks for being here. I'm excited to see what we have for in store for you next week on the Vegan Gym Live. Until then, be well.